Hello, my name is Martin Bohus. I'm a professor emeritus at Heidelberg University in Freiburg, and I warmly welcome you to the HOPE conference held in Bucharest. I will give an online presentation on next Wednesday on the topic of DBT PTSD. What is DBT PTSD? It's a treatment which is specifically designed for patients suffering from the consequences, the sequelae of early childhood sexual or physical abuse. Many of these patients suffer from complex PTSD. Many of these patients suffer from borderline personality disorder, and most of them suffer from both. So why was it needed to design a specific treatment when we had already DBT, which has been shown and proved effective in 15 randomized controlled trials? However, we all have seen that patients with co-occurring PTSD don't benefit from standard DBT. For that reason, it simply was needed that we design a specific treatment. DBT PTSD has been designed at Heidelberg University. We worked about 20 years on the development. We treated now, meanwhile, 1,500 patients with this treatment, and we have two large RCTs which show crystal clear that it works. We have strong effect sizes of 1.4. We have full remission rates of about 80% in the completers, and we can say it's safe. We don't see aggravation of self-harm or suicidal attempts during the treatments. So it's safe, it's effective, and it's quite easy to learn. So what is specific about the DBT PTSD? When you design a treatment for these people, you have to understand the psychopathology. And the psychopathology, the major problems, is are two dimensions. The one is the trauma memory, which results in very often in uncontrollable, repetitive intrusions and flashbacks and nightmares of the traumatic experiences. The second thing is the more stable problem. This is the trauma-related self-concept, and the latter is very often tainted by guilt, shame, self-disgust, self-hatred, self-contempt. And all the two components are maintained and sometimes even reconsolidated by a whole different sorts of dysfunctional behavior like self-harm or strong avoidance tendencies. So the treatment is a multi-component treatment which designs and targets the whole 9 yards of these problems. And for that reason, we had to work a lot of time to invest a lot of time to develop it. We have designed a treatment manual for the therapist and the client, and this combination of these two manuals helps you to, let's say, easily, smoothly process the therapy. So this results in a well-designed, structured treatment which you can learn within 6 days. If you have a basic education as a psychotherapist, and if you have a basic education in cognitive behavioral therapy. Yeah, if you're curious, I would be happy to see you at the presentation and where I can explain the whole thing a little bit in more details. Thank you very much. Goodbye.